Good morning. It's Thursday, the 5th of August. My name is Quinton. I'm one of the GPs at Mangara Medical. Just a brief coronavirus update for the coast and for our practice. So just heard Queensland borders have been closed now to New South Wales residents as of Saturday. So that's unfortunate, but that's a reality we are living in. Also, the Premier has asked that people start wearing masks, and you would have seen that in the media, but people start wearing masks in public settings when there's difficulty, keeping the social distance. When you go to areas of confinement, close confinement, as in places of worship, we have also implemented a mask policy at our practice, which I will elaborate on a little bit later. What has worked so far, we know social distancing worked, it's proven. Please keep on going as much as you can. Try and limit the trips, try and maintain your hygiene as well as you can. Wash your hands. If you are in close contact with other people, especially for a prolonged period of time, wear a mask. If you're asked to wear a mask, wear a mask for the sake of yourself and others. This is really not just for ourselves, but it's for the greater community. Early testing is crucial. If you have new respiratory symptoms, a sore throat, fevers, a cough, runny nose, however mild, it's really advisable to have these tested now. We cannot let a single case slip through, so really important to get tested so that we can contact trace and manage. There are no cases on the coast to my knowledge, but it does seem to be around us right now. It's to the north, it's in Sydney. Possibly a matter of time, but the more we can do to limit that spread locally on the coast, the better. As far as policies and procedures at Mangara Medical, we had very tight policies for a while. We kind of let them relax a little bit, but we're going back to tighter policies again. We have someone managing things at the front door. We have implemented a mask policy in line with advice that we've been getting. So you will be asked to now wear a mask if you come to Mangara Medical. Yes, it's a hassle, but yes, it's one of those necessary things we just have to get used to and do for not only for your own sake, but we see vulnerable patients. They are at risk, and our staff need to be protected as well. So please wear a mask. If you do not bring a mask, you will be offered to buy one. Yes, that is a hassle too. Unfortunately, we do not have an unlimited supply either. We have to buy them, and we literally have hundreds of people coming through the doors of our building every day. So mask policy in place until further notice. As far as appointments, you still do have the option to book face-to-face consults, but we do ask everybody to try and manage things telephonically as much as you can. So if it's something obvious that can be managed on the phone, please go ahead and book a phone consult. If at that stage we determine that you need to be seen, especially if it's urgent, we'll try and get you in as soon as we can. But phone consults primarily, especially if there's respiratory symptoms, you will not be seen at the practice with any new respiratory symptoms until you've had a coronavirus test. If that test then comes back negative, then we will consider seeing you if we deem that necessary, and that will probably be in the car park. Unfortunately, we're trying to keep all respiratory symptoms out of the practice, but take the advice from the doctor you speak to at the time. All up, we're trying to just limit foot traffic through the waiting room, but in saying that, life goes on. We are dealing with a pandemic, but all those other illnesses and problems that we had before have not gone away. So please don't let all of this detract from your usual care. If you need a skin cancer check, if you need your chronic diseases managed, if you need your prescriptions done, please still do those things. It's really important. We will not be able to manage the backlog 6 or 12 months down the road, and we still are happy to manage as much as we can within reason. So please at least book a phone consult, have a chat. If anything needs to be done, we'll give you good advice. So stay positive. Try and maintain the social distance. If there's any new respiratory symptoms, please have them checked as a priority. We have patients that phone in and go, you know what, I've been sick for a week now. Should I get a test? Absolutely, and don't wait the week. Get tested on day 1 or 2. Stay home until you get results, and then we'll manage things from there. So we'll keep you posted from our side as good as we can. Well done so far, and we'll talk soon. Thanks.